All right. Hello, everyone, and welcome to our Form Health webinar. Today's topic is medical weight loss right for me? And for those of you who haven't met me before, I'm Dr. Lemieux. I'm a physician at Form Health, and I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined today by my colleague, registered dietitian Casey Curlin. Just a few announcements for today. This webinar is being recorded and your participation is completely anonymous. And we would love for you to enter any questions that you have as we're going through the talk into the chat feature in Zoom. And at the end, Casey is gonna go over some of the questions with me, and we're gonna try to answer as many as we can. So with that, we'll get started. We are gonna talk about what is medical weight loss, review some of the causes of weight gain, cover what are the available tools for weight loss, and then finally spend a little time discussing FDA-approved medications for weight loss, as I know patients have a lot of questions about these. So medical weight loss is where a person's weight loss journey efforts are guided by the support and supervision of a medical doctor. And that involves a treatment plan that typically consists of lifestyle changes related to nutrition, physical activity, behavioral changes, and may also include medications. And we contrast this with surgical weight loss, where we are having a surgical intervention such as a gastric bypass or sleeve gastrectomy for weight loss. Now, while I mentioned medical weight loss is under the supervision of a physician, it's not always the case that a patient is just working with a doctor. There may be other members of the healthcare team, like registered dietitians like Casey, physical therapists, behavioral therapists, nurse practitioners, physician assistants. I mean, the list really goes on. And I think it's important to understand that when working with someone in the setting of medical weight loss, we're treating your weight as a medical condition. And so I thought it would be helpful to go over what my approach is as a medical doctor when I see patients for weight loss, to help you better understand what exactly is medical weight loss. So when I first see a patient, my goal is to try to get to know them and really think about what are some of the factors that are affecting their weight. Now, this picture is just to demonstrate that many factors contribute to weight, but this by no means is all of the factors. But some of the things I might be thinking of is there an underlying hormonal imbalance? Are there elements of the person's environment that are contributing to weight gain, like poor sleep or stress? What is their nutrition and physical activity like? And as a medical doctor, I'm also going to key in on to what medications a patient is taking. And believe it or not, these medications can actually tell me a lot about a patient's medical history. It can also provide some insight as to whether their weight has led to medical complications like high blood pressure, high cholesterol, diabetes. Another thing that I'm going to be looking carefully at is whether some of these medications that a patient is taking might actually be affecting their ability to lose weight, making it harder for them to lose weight. And so when working with a medical professional, you have that benefit of their experience and knowledge to really dive into your history and get to know you and understand many of these factors. Additionally, when working with a healthcare provider, they are able to order diagnostic or testing, and that may include tests to understand if there's some hormonal imbalance leading to weight gain, for example, an underactive thyroid. It may also involve testing to see if there are complications from the weight, like high cholesterol, diabetes, prediabetes. Now, when we have this information, understanding the patient's background, their medical history, the lab results, that's where we really can develop a comprehensive and personalized treatment plan for the patient. I do want to point out that any successful medical weight loss program should involve a strong foundation of lifestyle changes. Broadly speaking, nutrition, physical activity, these are key components. And some medical weight loss programs only utilize lifestyle changes. Now, nutrition programs can really vary from one program to the next. It could be more focused on improving quality of someone's diet, whereas other programs may focus on very specific calorie goals or carbohydrate intake to promote weight loss. And in fact, there are certain medical nutrition interventions that really require close medical supervision. For example, very low calorie diets. But I do want to just emphasize how important these lifestyle changes are as that foundational approach. And then when you do work with a physician or nurse practitioner, physician assistant, they may recommend medications for weight loss. And we'll talk a little bit more about who might be a candidate for medications and what those medications might look like. So when it comes to who is a candidate for medical weight loss, there are a few things that I see a lot in my patients. One is that maybe they've tried to lose weight before through efforts on their own with low calorie diet, physical activity, or other weight loss programs, but they've either been unable to lose that weight or unable to maintain the weight that they've lost. And so that's why they're coming to see me for medical weight loss. Or perhaps they have medical conditions that make weight management especially difficult. For example, someone with severe asthma who's frequently getting treated with steroid medications may be gaining weight as a result of these medications. But it turns out that potentially we can help lessen the effect of their weight on their asthma through weight loss. And they may need additional assistance when the diet and lifestyle changes are not quite enough. There are others who in general would just benefit from medical supervision, whether it's trying to understand, is there some underlying cause that's making it especially challenging to lose weight, or they have other medical problems that may require changes in their medication doses over time as they're losing weight. I will point out though, that in reality, many people may qualify for medical weight loss because you're having the supervision of your healthcare team really treating weight as a health problem. The other thing is patients are ready to make long-term lifestyle changes. And what studies have shown us time and time again is that things that are sustainable long-term are what promote the best success for weight loss. Another important thing to consider is there is no standard for how much weight a person needs to lose or body mass index cutoff for who's a candidate for medical weight loss in general. However, certain programs may have specific requirements. For example, at Form Health, we see patients with a body mass index of 30 or higher, or 27 or higher with a weight-related medical problem like diabetes, high blood pressure, or high cholesterol. I also want to point out just how challenging weight loss can be. Many of us are trying everything we can, doing the things that we're supposed to be doing, reducing our calorie intake, increasing our activity, and yet it feels like things are just pushing us in the opposite direction. And any weight we do lose comes back on again, or even then some. And the reality is there are physiologic changes that occur when we lose weight that push us back in that direction. Our metabolism slows, the hormones that increase our hunger go up, the hormones that make us feel full go down, and weight regain is extremely common. And I point this out because some of the medications that I'll be talking about for weight loss effectively are trying to address these hunger and fullness hormones and help prevent some of these things from promoting weight regain and further promoting weight loss. I also think it's really important to point out that these are just some of the contributing factors. So this is a very oversimplified model. The concept of just calories in, calories out being the only factor is not the full picture here. So what are the available medications for weight loss? The FDA-approved medications in the United States include our GLP-1 receptor agonists. These are liraglutide or Saxenda, semaglutide, which is Wegovy, naltrexone bupropion, also known as Contrave, phentermine, which goes by various names, including Adipex P and Lemieux, phentermine topiramate or Qsymia, orlistat, which is Xenical by prescription or Ally over the counter, and Plenity. And you'll see the asterisks there on the list. So one of them, phentermine, is a controlled substance. So it's actually not prescribed by doctors at Form Health. And Plenity, although I'm putting it in the list of medications, is technically classified as a medical device. So people who are candidates for weight loss medications typically are those who've been unable to lose weight or maintain their weight loss with lifestyle changes alone. And oftentimes insurance companies ask that patients have already tried these lifestyle changes for a minimum of 3 or 6 months per se. Additionally, the FDA criteria is that patients have a body mass index or BMI of 30 or higher or 27 or higher with a weight-related comorbidity like diabetes, high cholesterol, heart disease, high blood pressure, sleep apnea, and so on. Now, if you're wondering what is my body mass index, there's a number of free online calculators where you can enter in your height and weight, and it'll give you that number. So the next question that often comes up is, well, how do these medications exactly work? And the majority of them work by decreasing appetite and cravings by acting on these centers of the brain that regulate our eating behaviors. Additionally, the GLP-1 receptor agonists, these are liraglutide and semaglutide, actually slow digestion, and that can promote more feelings of fullness. Orlistat does not actually act on the brain. It works by blocking dietary fat absorption. So effectively, you're getting fewer calories from the foods that you're eating. And Plenity works by forming a fibrous gel that occupies about a quarter of the stomach volume. It's not actually absorbed by the body, and that's why it's classified as a medical device, but it takes up that space in the stomach so someone is not able to eat as much. And it also activates the stretch receptors in our stomach to send feelings of fullness to the brain. There are also medications that are FDA approved for other uses, but can also promote weight loss. These include other GLP-1 receptor agonists like Ozempic or Rybelsus, which are also semaglutide, but these are FDA approved for treatment of diabetes. There's also metformin, naltrexone, topiramate, and zonisamide. And so when working with a medical professional who's experienced in obesity medicine, if you are a candidate for medications, they can really help navigate this list and help you determine which would be the best fit for you. This time, there's no blood tests, there's no predictor of which one is going to be the right fit. So that's where the experience and really expertise of the medical professional comes into play. It's not just as simple, here's a prescription and this will work for everyone. I also want to point out importantly that just medication alone is not the full picture and is not the best way for long-term success. This is a study that looked at patients receiving different interventions for weight loss, either medication alone, lifestyle counseling alone, or medication with lifestyle counseling, either brief counseling sessions or more intensive sessions. And it may surprise you that just medication alone was actually the lowest amount of weight loss in this group of participants. And in fact, just lifestyle counseling alone, people lost more weight. But as you can see, when you have medication and you add in that lifestyle component, we're seeing more weight loss. Now, I will point out this is an older study, and the medication that was used in this study is no longer on the market, but this has been demonstrated with other medications as well that are currently being used. A more recent study looking at liraglutide or Saxenda compared patients receiving intensive behavioral therapy, either with or without the medication. So the group that did not receive the medication, they received a placebo instead. A placebo is something that has no therapeutic effect. They're in that gray line. And you can see they actually lost weight over time, on average about 5% of their body weight. But when you added in the liraglutide, that's that dark blue line, you can see that there was more weight loss overall, closer to about 9%. And so I think it really highlights the impact that lifestyle changes can have, but also adding lifestyle changes to medication can also be even more beneficial in this instance. So when we talk about weight loss medications, I think we should also talk about what they don't do. Weight loss medications do not rev up your metabolism where now you're burning 500 calories more a day than you were otherwise. They do not replace a healthy diet and physical activity. And I think it is so important to remember that healthy nutrition, an active lifestyle. These are things that have benefits beyond any number on the scale. Weight loss medications do not address underlying life stressors that may be contributing to one's weight, and they do not work for everyone. Now, many people want to know about how much weight loss can I expect with a weight loss medication. It will depend for each person, but what we know from studies is that on average, people lose between 5 to 10% of their starting body weight. The exception is semaglutide 2.4 milligrams or Wegovy, where we saw on average closer to 15% body weight loss. I also think it is extremely important to appreciate that there is the potential for weight regain after stopping a medication. And so oftentimes I explain to patients that while we call them weight loss medications, we also should think about them as weight maintenance medications. And I think this is illustrated really nicely with this study here of semaglutide, 2.4 milligrams or Wegovy. So what you're seeing in the orange line is people being started on the medication, and over time that dose is increased. And you can see that they are gradually losing weight. At the 20-week mark, they split these patients into two groups. One group continued with the medication, that's that dark blue line, and you're seeing that as time goes on, they're continuing to lose weight. The other group was switched to a placebo. Again, that's something that has no therapeutic effect. And that's in our gray line. And you can see here, importantly, they did not maintain the weight that they had lost. In fact, they're starting to regain that weight. And this has been demonstrated in studies with other weight loss medications. So I now want to turn it over to Casey to share her perspective and also explain to you what is our approach here at Form Health. So Casey, why don't you jump on in?
Sure, thank you. So the way the FORM program works is you'll be paired with both a doctor and a dietitian, and this is your FORM care team. You'll meet with the doctor monthly and then the dietitian about every 2 weeks for one-on-one sessions. In these sessions, we spend time getting to know you and learning about your everyday patterns and habits. This knowledge of your lifestyle helps us to develop a personalized, long-term, sustainable plan for you. So this is not a cookie cutter approach. We're working together to formulate your individual plan. And we aim to simplify the plan by breaking the foods you eat into 3 main food groups, which includes protein, produce, and carbohydrates. And we work on making sure your meals contain appropriate portions of these foods in order to keep you full and satisfied throughout the day. So keep in mind, you'll not be asked to cut anything out. We really help you to figure out how to include everything you want to have within the parameters of your meal plan. We also, though, work on finding ways to increase your physical activity. And for this goal, we take it at your pace and work on small ways to add in more activity throughout the day. So we don't expect you to stop everything and go to the gym for an hour a day. We try to find ways to add an activity that you're comfortable with and can easily fit into your schedule. So if that is just starting with like a quick 5 minutes of stretching or light weights or something like walking around your house a few times a day, that's perfect. That's a good place for us to start. But also keep in mind if you have, I've noticed in some of the questions coming up, if you have something that is keeping you from exercising right now, we can definitely work around that and get to that as needed down the road. But it's not something that you have to incorporate initially if there is a barrier. Another focus that we go over in your appointments is the focus of a mindset shift, where we focus on the emotional aspect of eating and address strategies for dealing with stress and emotional eating triggers. We help to guide you to start listening to your body, to really develop a sense of when you're hungry and when you're full to help decrease your portions at meals. So for each person, no matter what the roadblocks have been in the past for long-term success, we try to find sustainable ways to work around them through making small changes over time that in the long run lead to accomplishing your goals. And part of achieving these goals is having a great support system. And one of the main things that patients really like about the FORM program is the easy access of communicating with your care team between appointments via the FORM app messaging system. So here on the right side of the page shows an example of the FORM messaging system. Essentially, you're texting your care team. So if between visits there's any questions, concerns, or you just need moral support to stay on your goals, we're available as needed via the messaging system, which patients really appreciate the support system, and it really helps them to stay on track. Another very important part of being successful with your plan is food tracking and logging. Research shows you're more likely to be successful with losing weight and keeping the weight off when you consistently track your food intake. And for this reason, we highly recommend food tracking, and we suggest using the meal photos section of the FORM app to do this, which you can see here on the left side of the page. There is a section of the app called Meal Photos, where you can snap a photo of your meal and snacks throughout the day. And both your doctor and dietitian have access to these photos to review. And then between visits, if we need, we'll make comments. And then if not, we'll just use this meal log to help guide us on discussions in your one-on-one visits to maybe help further improve your meal plan. And so that's a quick overview of our program, and I'll turn it back to the doctor if she has any other comments.
Great. Thank you so much for that, Casey. And I also just want to point out the chat feature is so nice because you're actually chatting with real people. It's not like a bot that's just responding to every single comment that you make. It's someone who's actually met you or will be meeting you and giving you that feedback. So I'd love to take some time to answer some of the questions that have come in during this webinar. And while we're collecting those, I do want to point out our website, www.formhealth.co, in case you want more information or you want to check that out as well.
Yeah, so we have some questions that have come in. A couple are asking about if there's any kind of age restriction for the program.
My understanding is that we see only adult patients. So age 18 would be the lower limit. And in terms of upper limit, there is not an upper limit.
And then, which I kind of addressed this, I guess, in my section, but there were some other questions in regards to if they're in physical therapy or have any mobility issues, can they still, participate in the program?
Absolutely. And I think one of the frustrating things for patients, and Casey, I'm sure you talk about this a lot with your patients, is that we oftentimes feel like the physical activity is such a key component to our weight loss journey, but we may feel trapped. We have pain or physical limitations that keep us from doing that. And so we work with you to start where you are and what can you do realistically. And, I think it's really important to understand that there are significant things that we can do to either improve mobility, but also try to minimize the pain that you may be experiencing with that. Another thing, just from a medical perspective, is what research shows is that while physical activity is important for a healthy lifestyle, it's not the strongest factor for weight loss. So ideally, yes, we're including physical activity, but that's not the most important component, to be completely transparent.
Yes. Some other questions have come in regards to different types of bariatric surgery and if they would qualify for the program.
Great question. So can you elaborate more? Is it like if I have a history of surgery?
Yes. So there's been, some comments on duodenal switch, the gastric bypass, sleeves, just the different bariatric surgeries.
Okay. Got it.
They've already had.
Got it. Yes. So we actually routinely work with patients who've had a history of bariatric surgery. And in fact, this is something that oftentimes patients seek help for. That's why they're joining medical weight loss, because perhaps they've had the surgical procedure and maybe they lost weight initially, but the weight has started to come back, or maybe they didn't lose as much weight as they expected. And I'll be honest, unfortunately, many of my patients have had the experience where they feel like they're not getting the support that they need from their surgery team because the surgery is done and there's no more surgical option. So they're kind of left to their own. And that's where we come in. I mean, you're working with doctors who are board certified in obesity medicine, have experience working with this population of patients, dietitians also experience in this area. So that's what we can absolutely help with.
A couple other questions. One was, is all of this done over Zoom? And I'll answer that. Yes, your appointments with both the doctors and the dietitians are all conducted over Zoom. And then again, we can message you in the app between visits as well. Another question was in regards to some insurance questions as far as if it's covered by insurance. So do you want to answer that?
I'll have to defer to our moderator, Kim. Basically, our labs, visits, and medications are billed to insurance, but patients are responsible for any copays, and whether or not it's covered by insurance is, of course, dependent on your plan. But we also, if I'm correct in saying this, our FSA and HSA or potentially cover under the guise of FSA and HSA funds that can be used for our program.
Yes. And then a couple of other questions that have come up. That one patient saying that they're working on emotional eating, which yes, we definitely work in your individual sessions on emotional eating and triggers and ways to work around that. Another question, I think what they were asking is, do you have to be on the medication to be in part of our program?
No, absolutely not. You do not have to be on a medication. And I'm sure, Casey can also attest this as well. There are some patients who, just having that extra support gives them the edge that they needed that they weren't able to have before they joined our program, and just, losing weight through the diet and lifestyle changes. But medications may be an option as well. But just because it's medical weight loss doesn't mean it's medication for weight loss.
Exactly. And there's a lot of comments on, I've tried to lose weight in the past and I can't lose, which I'm sure both of us hear that all the time.
Mm-hmm.
And just what you just mentioned, I feel that because at Form, we are in contact with you as much as you need to stay on track. Oftentimes we'll hear this at the beginning of our appointments. I can't lose. I've tried this, and this, and it's never working. But the fact that we're able to really almost hold your hand virtually throughout the process, it really helps you to stay on track. So a lot of these patients they're in their same boat and feel they can't lose, we're able to really help them and get them going in the right direction. Do you have anything
Absolutely.
to add?
Yeah, no, absolutely. And I think, so a couple of things I want to say that just highlights how challenging weight loss is. I mean, these biological changes that occur during weight loss are the reason why so many people struggle with weight loss for their entire lives. And for many, many years, people have been told, oh, eat less and move more. And it's much more complicated than that. And I think it's really important to work with a team that understands that and actually is trying to get to know you and understand why it's been challenging. Not that it is challenging, but why. The other thing I'll mention is I've had patients, with our program or, in other settings where they say, oh, well, I've tried this medication. I've tried this one. I've tried this one. I don't have any other options. And I go back to, well, how did you try it? How did you take it? What did you do? And so there are instances where maybe a patient wasn't prescribed it in the right manner, or it wasn't adjusted accordingly, where we didn't give it the right trial. And so that's where working with a professional who's experienced in this realm is really important. And that's what you would be getting here.
Another question that came in is they've heard that if you're on blood pressure medications, then you can't take weight loss medications in addition to that. Is that an issue?
That's true for some medications, but definitely not all. And what I love about weight management is for many patients, I actually treat their high blood pressure with the weight loss and get them off blood pressure medications, which makes me so excited. You can tell in my voice, I get so excited about that. But no, it is not a barrier to all weight loss medications. And furthermore, although we see our patients virtually, we do have the ability to monitor blood pressure remotely. We can send you a blood pressure cuff. You know, you've also should have a primary care doctor who you're seeing as well. But we can keep an eye on the blood pressure even though we're not physically seeing you in the office. And it's interesting, there's some studies that suggest that home blood pressure monitoring is actually a little more accurate than in the office, as I'm sure you've all experienced, like running late to your doctor's appointment, being stressed out. You know, you sit for 2 seconds and then they're checking your blood pressure. Not the most accurate reading.
Yes. So let's see. So that's all the questions that we have right now.
Okay. Well, I want to thank everyone so much for joining us, for your time and your participation. Again, our website here, www.formhealth.co. And you can also give us a call or go on the website to schedule a call if you have other questions or want to learn more about the program. And I really hope that I'll be able to work with some of you in the future on your weight loss journey. All right. Take care, everyone.
Bye.